It's Cleanbeat 91.5 FM Abuja, the round table with Itsoha. It's a beautiful Wednesday morning, the 17th day in the month of June 2026. And weekday mornings we look at the covers of newspapers at 8:30 and then we get into the discuss for today. Well, Nigeria is facing a rapidly surging cholera outbreak, outspacing response capacity with health facilities under increasing strain as cases continue to rise. Also, more than 8,400 suspected cases and 85 deaths since May 2026 in Borno State alone. Plateau State is also seeing a gradual increase in cases with 53 reported cases and 5 deaths, as according to Business Day. The Nigerian Center for Disease Control has placed 10 states on high alert, warning that flooding would contaminate drinking water and break down sanitation. Now, just as a country enters a season when cholera cases always rise. We've had this warning before. We've had it in 2024 when cases jumped 220% and more than 350 Nigerians died. Now, most of the worst hits being children under 5. We also had it in 2021 when over 111,000 cases and more than 3,600 deaths were recorded. So here's the question at the heart of today's show, and it's deceptively simple. I like to say that. When cholera breaks out, we rush to doctors, drips, treatment centers, alerts are raised, high alerts here and there. But is cholera really a health problem? Or is it a sanitation problem wearing a health problem's costume? Are we treating the symptom while ignoring the toilet, the borehole, the open drain? Well, someone is here to help me this morning discuss. We're happy to have you. He is Mr. Sunday Oko, the program coordinator, Nigerian Health Watch. Good to have you. Good morning.
Good morning.
Glad you can make it regardless of the weather.
Yeah. Happy to be here. Thank you for having me.
Thank you so much. So let's get straight into it. Remember, WhatsApp is 09030005915. That's 09030005915. All right. So, Mr. Sunday. Every single year, like I just said, it feels like we go through the same cycle. So it's rainy season again. Okay, let's start talking about it. But a lot of people want to know, is it something that has to do with us as a people, or is it the environment we live in?
All right, thank you for that question. So I'll just I'll go into your question, but just to give like a background, you have already stated that in terms of incidence rate for Nigeria. So Nigeria is one of the countries most affected by cholera globally, and this happens it really picks up around particularly during the rainy season when flooding, poor drainage, and contaminated water sources increase the risk of transmission, right? And like you said, recent reports continue to show how these cases have been increasing over the last let's say 3 years.
Yes.
Now. Yes, and you said particularly our health authorities such as the NCDC have put some states at high risk, and the reason for some of these states being high risk states are states that are really vulnerable to flooding, right? And we know that when flooding comes, it comes with a lot of movement, drainages, poor drainage system, poor sanitation system. So yes, for your question, right, it's a mix of the two. It's both a health issue as well as a sanitation problem, and I'll try to explain why this is.
Okay.
So first of all, cholera is a disease that affects human health, and its root causes are often linked to things like inadequate sanitation, unsafe water, poor hygiene practices, and weak environmental systems. So today we face some of these issues, especially when it comes to during flood situations. So maybe I should stop there.
No, go ahead.
Okay.
Because I wanted to ask the follow-up question: why rainy season mostly? But go ahead.
Yeah. Okay, but basically, when I say it is a mix, right, I try to say that first of all, as a health problem, it causes illnesses, right? It causes things like dehydration, and oftentimes, or most times for children, like you mentioned, children under 4 or 5 years, it might lead to death, right? It has like a 3.3 case fatality ratio, and what this means is maybe when you have 3 cases of cholera, when you have 10 cases rather, you are going to have like around three deaths, right? So it's can lead to death. It places pressure on our health system. Our health system is already struggling to grapple with other infections, like
exactly.
So bringing cholera to the picture again makes it very difficult for our health system, and it also affects productivity. When you have a child that doesn't go to school in a home, or everybody is under tension, right? Nobody can go to work, nobody's engaged in any productive activity, and also these outbreaks are kind of overwhelming for our health system. Like I mentioned, we already have a very difficult health situation where we have like healthcare workers struggling. Our healthcare workforce is not adequate enough, so that's the part for why it's a health problem, right? In terms of why it is a sanitation problem, we see that cholera really thrives where sanitation systems don't work.
Okay.
Right, communities without safe toilets are at greater risk. For instance, in Abuja, you tend to wonder why we still have open defecation, right? This is the 21st century. You don't expect this, but you still see it on the streets of Abuja, on the highways.
There are some parts of Abuja you get to and you can't breathe.
I'm telling you.
Literally.
Yeah, I can relate, to be honest. Yeah. So you still see all of those things happening. So, and then we still have a very poor waste disposal system. I'll mention this because it has always been on my mind, right? There's a particular street somewhere in Gwarimpa where you can really not pass because of the waste. It's almost encroaching towards the high road, the road itself.
Yes.
So these are issues that you cannot just drive under the carpet, and also there's a lack of access to clean drinking water. These are some of the risk factors that help spread cholera. So it's important to understand how it spreads. That's why I say it's a mix of the two.
Yeah.
It's not just a health issue.
It's also a sanitation problem.
issue. Yeah.
All right. Let's quickly talk about some of the symptoms to watch out for as it concerns cholera, especially for children under the age of 5. Now, what are they, and also how quickly, with these symptoms, how quickly can it become fatal?
So, in fact, I'll start with your last question. It can become very fatal in hours, right? When it comes to children whose immunity is not yet very developed, first of all, cholera is caused by a bacterium called Vibrio cholerae, right? And people become infected when they consume food or water that is contaminated with this bacteria, right? If left untreated, cholera can cause severe. So some of the symptoms, I will just say that now, are some things like dehydration, vomiting. There's also diarrhea. Diarrhea is stooling, continuous stooling, watery stool, right? So these are the key symptoms. That you can also have fever in some children, but especially the key symptoms are diarrhea, vomiting, dehydration, and this comes with some fever. There's rising temperature. Yeah.
Okay. And also, you said it could get fatal in hours.
In hours, yeah.
Especially for children. What about in adults?
In adults, it's similar, right? Okay. Because when you are losing a lot of body fluids at the same time, both from your mouth through vomiting and stooling as well, it causes a lot of dehydration. And water, your body system is basically made up of almost 90% liquid, right?
Yes.
And when you lose that water in hours, it needs to be replaced. And when you are constantly giving out this water, it can lead to fatal situations, with the extreme situations are deaths. Yeah.
Okay, that's interesting. All right, still talking about cholera related illnesses, and last week we talked about malaria, talked about the flag off of SMP and all of those, SMC rather, and then this week we're looking at cholera. All of these are related with the rainy season and all of those. And then you talked about the burden on the for the country and also the healthcare system, and you also talked about open air defecation. Now, is it enough for, because I've seen it in some parts of Abuja excuse me, where some states have gone ahead to build toilets for public areas. Is it enough to just put public toilets in some specific areas, maybe like markets, like places close to high frequented areas? Is it enough?
So yes, I would say that's one step in the process, because historically we've seen that you need to enforce some of these things, right? Just putting public toilets is not enough, right? We have also seen that public toilets don't even have water, right? So there are things that need to be in place for them to work. So I would say, first of all, there is the role of government, but there's also the individual responsibility. When I mean the individual now, I've been to some of these public toilets, right, where you go there and there's water, but people don't use it, right? People don't wash their hands after they use the toilet. So there's the individual responsibility, and also there's the government part. The government part is to provide these amenities, right, at key places where people constantly gather, at marketplaces, at bus stops. And I think the government has even gone a step further to maybe incorporate some charges when you use some of these facilities.
Sometimes you pay 100 naira and all of those.
Yes, so this is to maintain it in terms of providing cleaning services as well as water.
Yes.
So I would encourage, like, the role of the individual, first of all, is to ensure that, okay, you use these facilities and use them properly. Using them properly will be that you make it very hygienic for the next person, in terms of when you use it, you wash your hands, you make sure you flush. These are key in terms of breaking the cycle of cholera. That's water and sanitation hygiene are very key. So you need to wash your hands properly. You wash your hands with soap and water, and this will help a long way. So individual responsibility, government responsibility, both.
That's interesting. All right, so at what point can someone contact or have contact with cholera? Because we've seen some persons who live in highbrow areas say, oh, cholera doesn't affect me, I live in a very neat environment, it has got nothing to do with me and my children. But they forget that their kids go to school. They're you have interactions. So is this something that can transmit from one child to the other?
Yeah, absolutely. So I will start by saying in 2024, right, we saw a rise in cholera cases in Victoria Island. You would expect that such a highbrow area
shouldn't have that.
Yeah, in fact, people called cholera a disease of the poor, right? But then, why is it coming closer to us? So why we are even doing all of these advocacy is to say that, you are using the same water source, right? Some of like our water supply sources come from surface water, like rivers, but then some of them are treated, right? But some go untreated. People still drink directly from these sources, and you interact with the high and the rich. They meet at the marketplaces, they shake hands at events, So these are ways that we can come in contact with the cholera. But then the major transmission is when you come in contact with the bacteria, which is particularly in this stool of humans, right? So, and this happens, like you said, this open air defecation, right? When rain falls, it washes it and
it goes into the water, the drains, and all of those.
And from there, we also see that for people in the highbrow area, one of the major areas that they get contamination to their water supply or food, right, is through maybe broken drainage pipes. You see I have seen some areas where you can see pipes being broken, right? So water is still flowing through those pipes, and when there's rain, some of those external
seep in,
right, and go directly. So these are areas that also can be checked. So regular checking of all of these measures would prevent constant transmission. We break that circle of transmission.
All right, for Nigerian Health Watch, when you go out to interact with people, do you get the vibe of people who see cholera as something that is normal, or something that is serious and that we need to tackle? So when we're approaching the rainy season, for instance, we know exactly what to do.
So Nigerian Health Watch does a lot of kind of feedback system, right? So we do some where we go to the public and ask random questions and vox pop, right?
Yes.
And then, so yes, a number of people still see cholera as like a normal, people say, oh, I eat a bad meal and I purge, right?
And then I get better.
So typically people will recover right, with very good immune systems, right, over time. But for the children that have like very delicate immune system, they typically need support in recovering. So it's really very important to emphasize that cholera is not something that just goes off. People have a sense of what the dangers associated with it, but some people still say they can't avoid. Like, some of the issues are people eat contaminated food, and this happens from food vendors.
Exactly.
A lot of our food vendors are unchecked. Governments in very in some countries, right, in some developed societies, no vendor sells food without having like vendor permits, where their food is properly checked,
and then they get regular checks,
exactly,
maybe bi-monthly or whatever.
So some of these issues are endemic because we have like a system that is not really working. But then I know the government is putting in efforts here and there to prevent. That's why there's been this early warning like announcement, right?
Yeah.
The NCDC has gone ahead of time to say, okay, we are expecting flooding. Can we clear our drainages? Yes. Can we basically cook our foods ourselves, right? If it's possible, right? Can you?
Awesome.
Yes.
Okay.
And if you can't avoid that, there are places that at least you can vouch for their hygiene in terms of the food they cook. So can you just avoid eating anyhow? There are parties around this time. Also, we encourage that you limit how you eat outside, and we encourage you to cook your food yourself, cook it properly. And it's not just cooking, right? It has to be properly cooked because these bacteria can survive certain temperatures. So it's about proper cooking, proper storage, and also personal hygiene, especially washing of hands when you use a toilet, because like I said, the major transmission is through humans too.
Yes.
So how to break that cycle is to cut off any contact with the bacteria itself. So yeah,
that's interesting. All right, it's 2 minutes past 9 o'clock. You can send questions if you have any to 0903-5915. Just a contribution to the topic for today. We're looking at cholera outbreak. We're trying to find out if it's a sanitation issue or a health, just a general health problem. And with us in the studio, we have Mr. Sunday Oko from Nigerian Nigeria Health Watch this morning. All right, so let's also talk about how we can eliminate this very, very annoying part of waste disposal. Waste disposal, at some point while growing up, we had sanitation days, maybe twice a month. You come out, you clear your drainage. It helped a lot.
Absolutely.
But these days, everyone's just heading out for Owambe on a Saturday or just having a good time, right? But proper waste disposal is a major problem. Just like you mentioned, even within the FCT, it's still a major issue. You'd be surprised that going to some places in Wuse, some places in Maitama, you just find waste everywhere. Sometimes it's even difficult for waste collectors to come by, maybe daily, to pick up this waste. And then when the rains begin, just like it is going on now in some areas within the FCT, it seeps into the drainages and then gets into water. So what do we need to do or put in place?
Well, so for short term, rather, I would say the government needs to do more, right? We need to hold the government more accountable in terms of the government has promised to give us good access to good health care and all, but also it's our responsibility to call them to where you seem to identify an issue. Like, for instance, we have said there are a lot of waste management issues in the city of Abuja, right? How can the government come in? So I know that the government is doing a lot. I know waste management is a lot, and for big cities, it can be a lot. I know how Lagos went through a lot to establish their own waste disposal system, and I think others can learn from it. Abuja can also learn from that. So we are calling on the government, right, to do more in terms of waste management. The government alone cannot do it, right? There are little things that we can do on our own as individuals, and this is where clearing your waterways comes to play, right? There are you can go into the city now, and when it rains, it's a mess on the streets, right?
Yes, it is.
Waterways are blocked. Water that's supposed to pass through the drains are coming to the roads, and as little as your cars passing on them, you use your hands to wash your tires, right? So somehow, some way that this
you come in contact with this bacteria,
yes, knowingly and unknowingly, right? So as a big fix, we are calling on the government, but also as individuals, we need to do better with waste management.
What about at the local government level? Let's even, because most of these issues, begin from the local government level. Our local governments, do they also need to sit up as well?
Right, absolutely. Like you mentioned, it starts from, I would say it starts from the family. Right?
Yes,
so,
it does.
So the local governments also have a responsibility, and that's to also encourage her citizens, her members to do better with waste disposal. It's so strange to me, right, when waste is actually disposed at the middle of the road.
It's always strange.
It's always strange to me, but I mean, it has become a normal today. But
and for some of us that throw things outside our vehicles,
yes,
wow, oh my God,
it has a long-term effect. Even though we think it's just a single wrap you throw, right, eventually it gets everybody accumulates and fills the drainages, and it affects the whole system. So there's that whole system that is broken if we don't do our part. So yes, at the LGA level, local government chairmen need to do more. They need to create more awareness. They need to encourage the system that you mentioned, bring it back. It helped. It helped
yes,
a lot. So I think that system needs to be encouraged, needs to be brought back, where people just dedicate certain hours to cleaning their environment, because I think for over time what works is enforcement, to be honest. And if you don't enforce some of these things, of course we have free will, but free will, if we leave our health to free will, I don't think
a lot of things will happen,
yes,
and a lot of things will go wrong.
So absolutely. So we need to enforce some of these things, and this enforcement has to come from the authorities, right? Saying that everybody has to do this on a particular day within certain hours. I think we can't eliminate it, right, but would reduce it, and this will go a long way in breaking the circle. Also, there is the whole oral vaccines that can be taken when during periods of these peak periods, okay, right? And also we encourage this to be taken by children. It's actually given when there is an outbreak, typically in states like Borno, for instance, where we have noticed outbreaks in recent years.
Yes.
And so these oral vaccines are actually available for them to take care, and they are actually given by the government also. So just calling on the government to do more with waste disposal, provide us clean drinking and accessible water, potable water supply.
All right. Still speaking about hygiene messages. Are Nigerians taking hygiene messages seriously enough, and what simple habits can significantly reduce the risk of cholera? You talked about washing of hands. You've talked about open air defecation that has to stop. You've also talked about cleaning of our drainages regularly. What other things can we put in place? Some persons have talked about boiling water. Is it one of the ways we can also
absolutely.
Okay.
So we for communities where they don't have access to some of this potable pipe-borne water, I think one of the ways to actually prevent cholera is to boil your water, right? Boiling it at 100 degrees centigrade will actually help purify the water against this bacteria I mentioned. Also, another issue that I want to particularly mention is the issue of misinformation, right? We saw that during the outbreak in Lagos 2024,
yes,
one thing that came out was the tiger nut drink.
Oh my God.
People now started saying tiger nut itself was
able to cure.
No, not really cure. Was
okay.
the cause
of cholera. Okay.
And it led to a lot of misinformation. People started avoiding tiger nut, right? And actually, when further analysis on the tiger nut that people identified as the one that started the cholera outbreak, then was the preparation method, right, that caused it, and not the tiger nut itself, right? So it could be the water,
okay,
and that's so there's still a lot of misconception when someone starts purging. People say, oh, it's maybe it's a cause. There are some communities that don't believe that someone should purge, right? They believe that there is a lot of misconception when it comes to these diarrheas, right? So we need to do more. I worked on a misinformation project, and Nigerian Health Watch champions that project, right? And it's a health misinformation project. We try to gather a lot of insights from community members. What do they think about cholera? We listen to them, and a lot of concerns. Some still had issues about what to take, So why I'm saying this is there's still a lot of gap in knowledge. People don't know what these things are, what are the methods of preventing them. People are still unaware. There is still a lot of knowledge gap. There is still misinformation trending out there. I know it's very easy these days. I don't know if you have received messages where they say send to 10 people in 10 minutes and receive 10 million, right? Yes. And if you don't do it in 10 days, you die.
Yes.
So all of these things in a fast-moving world where information really circulates fast, our duty is to break the cycle by questioning, what am I sharing? Is it actually right? Have I confirmed with other sources? Have I tried to ask, maybe, like for instance, you are an on-air personality. Someone can call in to say, okay, they heard this, right? You can help them. So I encourage people to ask before you share, right? Don't just rely on what people say. So also check in at your regular. So treat every symptom as an emergency. Basically. So at this peak season, if you have cases of cholera, if you have cases of vomiting rather, quickly just go to the health facility, right? And where you get, don't use I don't know how to call it. Is it Agbo they call it?
Another local, purification herbs.
They tend to want to be cheaper, right? But
they aggravate the issue.
Exactly, and their long-term effects can be detrimental to your health. So we encourage that you seek proper health care at your primary health care center or at a general hospital, as the case might be.
All right. Yeah. So for communities, that's at the community level, what can they do now? What are some of the things they need to put in place immediately? Because like you said, it begins from the family units.
Yeah. So I would say for communities that don't have like public toilets, one of the easiest ways is to try to come together and kind of build a public toilet at maybe areas where people gather more. So that will help a long way. But at the personal level, it can be little things like clearing your grasses, right? Keeping your environment clean. Let storage, especially storage, how do you store your food, so these are ways that we can prevent it. Regular hand washing, we cannot overemphasize that. You need to wash your hands as often as possible. In fact, if you can wash hands, I know during Ebola the system of washing hands was really encouraged. Afterwards somehow we have forgotten about it. But somehow, this on a side note, we are seeing cases of recent cases of Ebola again in other some African countries. So I think we need to encourage hand washing, proper hand washing, actually proper regular hand washing. Water. Yes, so that's something that at the family level we can do, and also encourage at homes to some I've seen some landlords that really don't build proper toilets, right? So it's all about also raising this advocacy for, so if you live in a compound where there's no adequate toilet, the toilet is very bad, I think the tenants can come together and say, oh, if you don't build us something great, we won't pay our next rent. So we need to take responsibility for our own health as individuals, also hold the government accountable, make demands to your local government. Please, can you put a toilet here? There are some areas you go to, and because of the smell of urine, right, you can't pass through those areas.
Yeah, I'm surprised you didn't talk about short puts anyway.
Yeah, too.
Because that's also very popular, even in the FCT. You hear people who tell you or give you experience of how they went to a particular locality and they had to, go through the process of short putting. It's so annoying to listen to.
It is actually. I just hope that the authorities are listening and they are also ready to help to kind of bridge the gap in all of this here.
So at the local government level, ensure that you have proper toilet facilities for your members. It could also be a constituency project for you. All right, see how you can build toilets for your constituents, and also at the family level, wash hands under running water.
Boil your water.
Ensure that your food is properly stored, whether in the refrigerator or in cans. Proper coverage covering, that's very important. For kids, ensure that they wash their hands when they return from school. I personally am very concerned when I know that my kids have to eat lunch in school. I don't know if they wash their hands, because that's, there are some things you cannot control. So we also encourage schools to watch after the kids, ensure that they wash their hands.
Absolutely.
And maybe have sanitizers around.
Absolutely. I think this is something that parents can actually take on during PTA meetings, Parents Teachers Association meetings. I think they need to also demand from the students, from the school authorities, that these things be put in place and ensured, and also sanctions be made also, because where there is a law and there is no sanction, people tend to break them. So what happens when you come into class without washing your hands?
Exactly.
Right? Maybe I'm not saying they should beat them, obviously, but little things,
teach them,
yes,
so that they imbibe that culture.
Exactly. So it sticks with them even after they leave school. So these are things that we need to put into perspective as we think about eliminating cholera.
All right. So eliminating cholera. This one's coming is a question. It says, eliminating cholera, is it possible?
Yes, I would say yes. It might take a long while. In the early 80s, or will I say 70s, I wasn't born then, but I know that chickenpox was an issue, right? There was no vaccine for chickenpox. Today, right, there's treatment for chickenpox, and typically you only see just a handful of cases for chickenpox. So this goes to say that cholera also can be eliminated. But if we don't do some of these things, like I always say that if we only treat cholera patients without addressing things like unsafe water and poor sanitation, outbreaks will continue. So if we want to end cholera, it requires a shared responsibility, like I said, between individuals, communities, and even the government particularly. So it's possible, but then it has to be, it's hard work. It's work that we all have to put in.
All right. This one's coming through. Says, how can communities protect themselves, and what should people do if they suspect cholera case?
Yes, so we already mentioned how we can protect, but I'll still emphasize that. But when you suspect a cholera case, in their home remedies, right, that you can actually do before you go to the hospital. So if it's very severe, I would encourage you to rush immediately to the hospital. But in cases where maybe we know how Nigeria is, health centers can be quite far from your house. So I would say there are home remedies you can take to prevent, to manage it before you seek proper medical care, such as use of salt and sugar solutions. But however, the caveat here is, because you might not be able to measure the right quantity, we encourage you to have this ORS, the solution.
The solution.
Yes,
that's sold at local pharmacies.
So you can always get that and keep in your house. Of course, these things expire, so you need to also watch out for the expiry date. Yes. So you can have that as a temporary fix while you seek medical care. But then we shouldn't. We are not encouraging you to rely on self-medication, right? But we are saying in cases where it's an emergency, right, you can take this while you try to seek medical care. So the best solution is actually to seek medical attention at your PHC, at your general hospital, as the case may be. So seek medical care. Avoid self-medication.
That's important. And also, I've heard people talk about how zinc helps. I have seen parents who say, once your child comes down with diarrhea, just give him zinc. That's misinformation, right?
That's misinformation. Again, I wouldn't encourage that, because sometimes, right, what this diarrhea can be as a result of teething, right? It can be as a result of something else. So why treat a bacteria is specific, right? You want to give it what is actually meant for it, right? So you don't want to give a drug that is not meant for treating malaria, for typhoid. So it has to be specific. So to avoid all of this back and forth, it's better you go to the hospital, where they will now check you to know exactly the specific issue. So because all of these things, like we said, are symptoms, right?
Not necessarily the cause.
Exactly, they are not actually because you can have similar symptoms. For instance, malaria has fever, cholera has fever as well. So you need to,
let's be sure what we're treating.
Exactly. So,
okay, that's important. And also, finally, long-term measures needed to prevent further, or rather future, outbreaks.
So I'll start by reiterating what I've already said. Things like sustained water infrastructure. We need to build better infrastructure for our water system, improved sanitation facilities in terms of waste management. We can't overemphasize that, because at the end of the day, when rain falls, all of this waste that we dump on the roadside all washes down into our water. And for those people that rely on surface water, right, it's not like surface water is bad, but when it's untreated, it becomes an issue, because most of our water comes from rivers and the rest, right? Only a few people use boreholes and all. So there's also the importance of stronger environmental health system. There has to be increased investment in wash, in our. So when I mean environmental health system, we're encouraging people to go back to the system of regular sanitation days where people clean up their sanitation.
Yeah.
And then the final part is I'll stress is community ownership, right, for their hygiene and sanitation. People need to take it upon themselves that this thing affects me, so I can't see my neighbor throwing dustbin in the gutters, right, and allow
and watch them.
Yeah, so you might think, oh, it's washing to, it's not coming back, there's no backwash to my end, but someone else has put in behind you, right? So it's going to also stop at your front.
That's right.
So we need to take ownership of our health, we need to take ownership of our hygiene as well. So encouraging people within your community to also wash their hands is also something that your children will play with other children.
That's
right. So you would shake hands with people in public. Yes. Right? You cannot avoid some certain things. No matter how hygienic you think you are, right, you would have to integrate. You are not an island, right? So somehow, some way, there's that integration that you have to have with community people. So take responsibility. Take it that you are responsible for your health, and that way I think would become a better society.
Thank you very much. So no matter how hungry you are, please wash your hands before you throw that food into your mouth. Yeah, some of us are guilty of that because, I'm so hungry, I just want to take this. But please wash your hands, and if you have access to a sanitizer, make it a regular. Put it in your handbags, wherever you're going to. They come in very cute pocket-sized shapes these days, so you could throw it into your pockets, but just have it around to safeguard yourself. Thank you so much, Mr. Sunday Oko. Thank you for having this conversation with us this morning. And hopefully by the next time we're having this, we would see a lot of progress made with this report brought out by the NCDC, and also see that we have a society that is for better for it, so that next time, before the next rainy season, we'll see cases drop. We don't want to lose people to death. It's very unfortunate, and the country is dealing with a lot, dealing with cholera again. Come on, we can do better as a people. Mr. Sunday Oko is the program coordinator in Nigeria Health Watch. We appreciate you for all you do there, and we'll see you soon, hopefully.
Thank you very much for having me.
Thank you so much. All right, that's the round table for this morning. Thank you so much for joining us, and thank you for interacting with us. We appreciate you. It's 9:23. The Clarity Starter continues. My name is Itohan. Remember, round table comes up every weekday from 8:30 a.m. Good morning.